Hello, my name is Holly and today you are watching Crash Course. This week we'll be discussing nightmares and emotions. What are the emotional characteristics of nightmares and what are their consequences? Nightmares are unpleasant dreams comprising of vivid, emotionally disturbing visuals or feelings. Nightmares can elevate our experiences of emotions and may occur as a response to current anxieties experienced in waking consciousness or as a side effect of PTSD. Freud, commonly referred to as the father of psychoanalysis, investigated the cause and meaning of dreams throughout his work. According to Freud, the content of our dreams is derived from our experiences in real life and is a form of wish fulfillment. Nightmares can occur occasionally for the average individual, but for those with nightmare disorder, they can occur much more frequently. Night terrors are a sleep disorder in which the sleeper does not experience distressing imagery, but rather experiences extreme emotions of panic or dread. Emotions are states associated with the nervous system that depict our actions, behaviors, state of mind, and reactions to stimuli. Emotions can be reflected in countless ways and are particularly intensified during episodes of nightmares. The emotions we experience during nightmares can be so distressing they may cause the sleeper to awake. The most common emotions expressed through nightmares are fear, dread, anger, sadness, and anxiety. The Cannon-Bard theory of emotions suggests that we experience both a physical and emotional reaction in response to a given stimulus. According to this theory, the physical symptoms such as sweating, shortness of breath, and periodic leg movements expressed during nightmares may occur as a response to the distressing imagery. Nightmares can cause severe disruptions to everyday life when experienced frequently. The consequences of nightmares can range from short-term physical symptoms to much more severe and long-term effects. For those living with PTSD, frequent nightmares surrounding the trauma can prevent the individual from recovering from the event, consistently drawing attention towards a painful memory. Anna is a 16-year-old female living with PTSD and experiences frequent nightmares that exacerbate her trauma. Anna underwent treatments purposed to treat her PTSD but found that this had no effect. Anna then underwent therapy to address her nightmares directly through cognitive behavioral treatment and reported a significant decrease in nightmares following a 3-month checkup. Insomnia, the intentional or unintentional inability to fall asleep, can also develop in response to frequent nightmares, which can lead to lower mood, irritability, memory loss, and fatigue. Due to the lack of current research into nightmares, there are few treatment options to guarantee recovery, but if you are experiencing frequent nightmares, there are a number of potentially effective therapies that you can try, such as cognitive behavioral therapy, progressive deep muscle relaxation training, hypnosis, eye movement desensitization and reprocessing, and image rehearsal therapy. Now let's have a look at the key take-home messages from this crash course. Nightmares can occur as a reflection of negative emotions experienced in waking consciousness. The key emotional characteristics of nightmares are fear, dread, anger, sadness, and anxiety. And lastly, nightmares can exacerbate the effects of PTSD and prolong recovery. Thanks for watching!